completed the course, and we'll do that after the break. During the break, I want to take y'all and show you the dental clinic, which we didn't get to see the first night we were here, just to show you some of the amazing things over there. So, but we should be done early. Yeah. Okay. So I asked Ms. Walsh to give me her resume, which is kind of impressive. It has, you know, awards and publications and all that. But I will tell you what struck me, just a few things. First of all, it looks like you grew up in Massachusetts. Is that right? No, you just went to Smith College because where'd you grow up? In Memphis, Tennessee. Okay, well, she went to Smith College and got a degree in history with a minor in Italian language and literature. And then you went to The Hague in the Netherlands and got another degree in social policies for human development. She got a master's of public health at Tulane. And then she, some years later, got her family nurse practitioner degree at the University of Massachusetts. So interesting that you have a teaching certificate, or did, taught elementary school. That's just very interesting to me. She's been board certified as a nurse practitioner since October 2013. So some of the interesting things that she's done, she was in the Peace Corps. Let's see, where is that? You were in the Peace Corps in the Philippines. She then has worked along the Thailand-Burmese border in refugee camps. I think maybe you're going to talk some about that. She's worked in Bangladesh, fascinating. And then she's worked at Church Health since 2020. So how many languages you think she speaks or has a familiarity with? Yeah. So Italian, Spanish, which she's got a lot of practice of here lately, Ilocano, Thai, Burmese, Karen, and Bengali. How cool is that? So anyway, very interesting person. Thank you for agreeing to talk with us.
So some of the things she just went through on my CV, we're actually going to talk about that tonight. Share a little bit more about that. Make sure, okay. So in general, first of all, I'm not super comfortable talking about myself, but for the purposes of this class, I determined that telling my story is probably the most demonstrative way for me to share what serving the underserved means to me, because that's kind of been a lot of my life. So there it goes. So I'm going to tell you a bit about my story. But along the way, y'all might see places where you see yourselves, you know, now or in the future. My path is rather louder. Okay. My path is rather circuitous, as yours may be as well. So I'm going to talk for about 25 minutes or so. I have some pictures to share, not too many words, mostly pictures. And then we will have a couple of discussion questions like we did with Jonathan, where you can talk at your table. And then we'll break, as she mentioned. So this is just an overview of what kind of the trajectory of my life that we're going to go through. So I grew up here in Memphis, as we just heard, first in East Memphis, then I moved to Midtown, went to White Station High School. My parents were both Memphians as well. And they made a concerted effort to focus on social and racial justice in our household. They were both in college in the 60s during the height of the Civil Rights Movement. And in particular, my dad, having left the South for college, they both became keenly aware of the injustice and inequities in Southern society. So, so you've heard the TSA announcement, if you see something, say something. That's essentially what we were taught growing up. If you see someone being treated unfairly, say something, or better yet, do something. My dad, who would write letters to the Commercial Appeal back in the 70s, decrying police brutality toward Black people, protesting against inequities in public education, things that unfortunately still exist today. He was my Atticus Finch. He taught me to spend time in other people's shoes and to get to know their point of view. So my parents were intentional when they enrolled my sister and me into a predominantly Black public elementary school here in Memphis in the early 80s. We hosted different international guests in our home. We routinely volunteered to serve the underserved in soup kitchens and Meals on Wheels, things like that. My mother focused on raising two girls who believed they could do anything they wanted, fly a plane, be an astronaut, areas that are still woefully underrepresented by women. My church, the church I grew up in, was a Baptist church here in Memphis, and we hired a female pastor in the 80s, which promptly got us disfellowship from the Southern Baptist Convention. And then that same church had already been racially integrated in the 60s, which prompted half of the congregation to leave. And then also in the 80s, we were openly welcoming and affirming during the AIDS epidemic, when homophobia was soaring to new heights. So I'm no stranger to bucking the system, to taking a stand. I was really active in our church youth group. Many of you probably were at one point too in yours. And through our youth group, we went to the Heifer International Ranch in Perryville, Arkansas, where we had an immersive experience in their global village. If you haven't heard of it, I recommend to check it out if they're still doing it. But from there, that was when I was determined to go overseas and learn more about how the rest of the planet lives. So I left for college at 18, as Dr. Nelson mentioned, but I didn't come back for 23 years. Well, I came back to visit for holidays, but I didn't come back to live here for 23 years after that. And I encourage all young people to go as far and wide as possible, because the further you go, the different perspectives you get, the more humility you gain about yourself. So I studied at a small women's college in Northampton, Massachusetts called Smith, where I took a year-long study in Florence, Italy. And then I also got a teaching certificate for primary school. So I was all set to teach primary school after college. But then I got myself on a plane to the Philippines with the Peace Corps right after graduation, and life took a different direction. So I knew nothing about the Philippines at the time. Was it 1P, 2Ps? Knew nothing. But I was hooked as soon as I got there. So after 2 years of commitment in Peace Corps, I extended for a third year. I wasn't ready to come back. And continued living in my rural, remote mountain village hut with no running water, no electricity. It was ideal for me. It's still the most nostalgic time for me. This is my neighbors. That's me with my neighbors out there. So after I finished 3 years, I couldn't extend longer at that time. So I wanted to put my experience into some perspective so I could be more useful in the world. So I took a 3-month certificate course, also that Dr. Nelson mentioned, in The Hague, the Netherlands, looking at social and economic policies for health and education in the developing world. And then I came back to the US and got my master's in public health. And this is where I say sort of my humanitarian work began. I studied international health and development at Tulane. And then before I even graduated, I got back on a plane over to Thailand, got my diploma remotely, where I started working with refugees from Burma, or Myanmar, as it's called now. And at that time, I knew nothing about the Karen refugees. I didn't know how long they had been there, why they were there. Again, I didn't know anything, but jumped in. I knew it would be another Southeast Asian mountain community like the Philippines. And it would just be something new to learn. So my contract initially was for 6 months to work in refugee camps along the border of Thailand and Burma. And I stayed for 5 years. So once again, hooked. First, I worked in the refugee camps with a non-government organization. But then after that contract ended, I found a community clinic that was outside of the camps that was run by people from Burma. And I joined in. It was founded by Dr. Cynthia Mong, a Burmese doctor, and run by medics and midwives who were from Myanmar. So the staff reflected the community that they were serving. And so I just helped with various projects for migrant populations, for refugees, for internally displaced populations, a whole host of different people on the border there. Most of the projects I worked on were related to reproductive health. I facilitated trainings in the community alongside local counterparts. One woman in particular, her name was Noda. We were like 2 peas in a pod. We would get in the boat and go across the border and go to these far-flung villages. We'd ride on a songtao or the Jeep. We'd walk on foot through these mountain communities, and we would give trainings to these communities that hadn't had anybody coming to teach them or to help to educate them about various health things. So I felt called to be part of a movement that was larger than myself. And it was led by those who were most affected. And then I could just add what I could from my Western education. But my goal was helping them to achieve their journey. So we were aiming to build sustainable systems to prevent maternal and infant mortality through safe obstetric care, family planning, adolescent reproductive health, and a host of other things. They knew their culture, they knew what they needed, and I could bring in the public health aspect of things, grants management, monitoring and evaluation, training of trainers, those kind of skills to help them achieve their goals. But in no way was I leading the charge, which is right where I felt like I was meant to be. Now, this is a training in the clinic, that the clinic where I was working. But while I was working there, I decided I needed more training. So there were just so many needs and so many ways to help. In public health, I'd been focusing on the forest, but I wanted to focus on the trees as well. So I kind of went backwards. A lot of people go into clinical work and then go into public health. So I was in public health first. So I contemplated, what kind of clinical training did I want? Did I want to go to medical school, PA school, NP school? And I settled on NP school because I liked the model, focusing on treating the human and not the disease, which is what we talk a lot about in this class. That is really what nursing is. It's treating people and treating people to how to manage their disease. It's not treating the disease itself necessarily. And so I liked that model. And I was already in my early 30s at the time. It was a cheaper, faster route to clinical care. So I came back to the US, again to Massachusetts, to UMass at the Graduate School of Nursing. And then while I was in nursing school, I discovered, lo and behold, there was a small group of Burmese refugees in Worcester, 200 of them. Who knew? I had no idea when I went there. But it was just sort of serendipitous. I was new to the city. They were new to the city. I knew some of their culture. I lived in the place where they were from. So I decided we could navigate the new world together. So I started visiting them in their home, helping them access services. And along the way, I found others who were doing the same thing. And then I invited more people to join, other health professional students at UMass. I put out calls, people come, help. And so we founded a nonprofit called Worcester Refugee Assistance Project, or WRAP. And it still exists today. We provided after-school homework tutoring for the kids. The parents came too, and they would learn English in a different classroom at the same time. We had a youth group for teenagers to go on different field trips, hiking. We got the kids enrolled in soccer. We kind of became soccer moms, but helping the parents also learn how to be soccer moms and dads. We had a Saturday morning program for the younger kids too. But most of all, we just provided a space for them to be together. When immigrants and refugees come to the US, they're often struck with loneliness, even though their other community members may be in the same city with them, but it's just much further apart. It's harder to get places different from where they came from. So having a space to gather and enjoy togetherness was just an important part of their mental health and their strength in navigating a new world. Okay, so after I finished my NP degree, I stayed in Worcester and I began practicing at a community health center there, the same place where I did my clinical training. And soon many of my primary care patients were the same refugees that I had been working with. I knew them already. I'd been in their homes. I'd already helped them navigate all the services. So it was probably the most comprehensive experience with social determinants of health in a clinical setting where I got to help with all different facets. One woman in particular sticks out in my mind. I'll just share a story about her. She was in her 50s. We're not sure exactly how old she was because, as with many refugees and immigrants, they don't necessarily know their birthday. They didn't have a birth certificate. So her birthday was January 1st. And then the year was estimated based on different events, different things that happened in her country. They could try to figure out exactly how old she was, but somewhere in her 50s. She was Karenni, that was her ethnicity. And from Myanmar, and she had been blind for 10 years before coming to the US, and her husband was deaf. So of course, everyone in the community knew this couple, very, very notable. And everybody thought she would be blind forever. But a routine eye exam revealed that she had advanced cataracts, easily reversible condition. So at that point, my role in the nonprofit was to drive her to and from appointments, make sure she got places, make the appointments, communicate with the providers that were there, because Karenni interpreters are very hard to come by on the phone or elsewhere. And this was before I was her PCP, so this was in the prior role. But the day I remember most clearly is after she had had both procedures on both eyes. I think she was going for a follow-up appointment and was picking her up. And she came out of her house, and I must have said something because she just looked at me, and this huge grin got on her, a toothless grin on her face. She comes and gives me this big bear hug and starts giggling and laughing. I can't understand her because I don't speak Karenni, but it was very clear that she was putting together that my voice, that she was seeing me for the first time. So she knew my voice. She knew I was the one driving her everywhere, and she was just overjoyed. And so, of course, that was a very momentous experience for me too, to make that connection, for her to see her make that connection as well. This is a group of the elders in the refugee community in Worcester. We would, through the nonprofit, we would have a holiday service where we would honor the elders as they do in their culture. So the young people would come up and give them each a gift. And the woman I mentioned she's in that group. And I think they've got blankets there. So it was a very touching intergenerational experience. Okay, so I wanted to talk about some definitions here. This is the only slide that has words on it. Dr. Morris talked a bit about knowing the status of your patients, knowing undocumented, documented. These are a few other legal statuses that make a difference in terms of how your patients can access services, not just health services. These categories were created after World War II by the United Nations in 1951. You can read the definitions and notice some distinctions highlighted in red. Asylum seekers, for example, are not granted the same access to services as refugees because refugees already have refugee status when they arrive here. So refugees get a social security number, they get social security benefits if they're of age, they get access to Medicaid, SNAP benefits, a lot of services here that asylum seekers don't. And then a number that's not listed on this page, but I wanted to mention because it's more recent, is 4.4 million Venezuelans are displaced abroad. They're not refugees, they're not asylees according to these categories. They may certainly have qualified or would qualify, but they're not at the moment. So that's another 4.4 million on top of 89 million of forcibly displaced people around the world. That number just keeps going up. It never goes down. I don't think it will go down. All right, shifting back a little bit to personal note. So when my mother died in 2016, just 3 weeks before my husband and I got married, we began discussing moving back to Memphis because we were still in Massachusetts at the time, but we wanted to be closer to my father. And then in 2017, when we started that moving process, the Rohingya exodus happened, where the Rohingya community from Myanmar was ousted into Bangladesh after a brutal government-sponsored military campaign, which has now been labeled a genocide. And so once again, I felt called to be part of a movement that was larger than myself, which is theme here. So I accepted a position. I was, in between jobs, right? I had just finished my job there. I was on my way here. So I accepted a position with another non-government organization that I knew already from my work on the other side of the border. Oh, that's me going over there. And then this is the map of where I went. So I soon became the country director of a community-based response in Cox's Bazar, Bangladesh, nestled right there in between the two countries. This time I was leading the charge, but my goal was to provide a platform for the Rohingya community to organize and serve their own community. So we hired local doctors and midwives. We trained community health workers from the refugee camp. My husband joined me and he found work in the education sector. And at that time, it was the largest refugee camp in the world with 1 million people living in an area the size of Shelby Farms. So we stayed in Bangladesh for nearly 2 years until I was 30 weeks pregnant, just like that. When we decided we needed to come back to Memphis, although prenatal care in Bangkok is actually pretty darn good. And then 4 months after my daughter was born here, I started working at Church Health in March of 2020, just as the pandemic was being discovered. So I found a new place here at Church Health where I could continue my calling to serve the underserved. I had no desire to work in private practice. Never in my life have I. As I felt there were already lots of people waiting for those jobs. It's just not where the need is. Our healthcare system is so broken, starting with the preposterous notion that you have to have a job in order to get good health insurance, that there will always be people who don't have access to healthcare. And then to close, I have actually several things to close, so a little bit longer here, but I wanted to summarize sort of what my experiences overseas, how they have actively helped me to reflect on my role in the world in general as a clinician and as a human being, and how that helps me to live with intention and practice with intention with patients. So I find that my humanitarian work overseas, which I consider my first career, it continues to inform my work and my approach to life. When I meet patients from other countries, I can engage in conversations about where they're from, what's the political situation. I can acknowledge the stress of being so far from loved ones and the worries about their safety, theirs and their families, and the enormous struggle it is to adjust to life in the United States. In many cases, I can try to speak some of their language. I've attempted to learn several over the few years that I've lived in other countries. And I can remember and acknowledge all the amazing and complicated lives that they lived before they came here. People had to leave so much behind, right? Their identity has been shifted so much. And so having that conversation, engaging that conversation really brings that humanity back to this exam room. And then apart from my work at Church Health, so in my church, the church I go to now, I'm a ruling elder, where I lead our mission and ministry team. And we have a relationship with World Relief, which is the refugee resettlement agency here in Memphis. We have a good neighbor team through our church that is welcoming a family of 12 from the Congo. There are 10 kids, 2 parents. They just arrived last month, and they spent the last 11 years in Malawi in refugee camps. So you can imagine all the social determinants of health affecting a family like this, ages 3 to 16, 10 kids, with 2 parents, just everything under the sun. So our role as a good neighbor team is to make friends with them, to help them to feel welcome in Memphis. We don't necessarily have to make sure they get to their doctor's appointments or get them Social Security. That's what the Refugee Resettlement Agency does. But we're just there to be welcoming. So we've taken them to the zoo. We took them clothes shopping. This Saturday is my daughter's 3rd birthday. We're going to bring some of the kids to my daughter's birthday party. So, just fun things essentially to make them feel welcome. It's going to be really cold though. Yeah. Going back on a personal note again, my father died in 2020 after a brief battle with pancreatic cancer when my daughter was just 10 months old. So in case you haven't noticed, multiple major life events in the course of 4 years for me. Both my parents died. I got married. I had a baby. I moved to another country, came back here, new life kit, house, car, new cat, everything. So while compassion is certainly part of my plan of care with every patient, I can definitely say that I have some life experiences, global, local, and personal, that helps me to empathize with the underserved, who more often than anything need someone to listen. I'm always reminded that it's not about me. I need to listen with the intention of walking in their shoes. And in that way, I'm honoring my parents and how they raised me, and I'm passing on the gifts to my daughter. And I wouldn't be remiss if I didn't mention my upbringing and identity as a white woman in a southern city in the United States. If anything, the lens through which I see others around me has been enhanced by my experiences abroad, as I've witnessed how I'm perceived as a white woman in other countries in the developing world, and how different ethnic groups treat each other in their own country's borders. So the United States does not have a hold on racial and ethnic injustice. My parents were middle-class white Memphians, and from the beginning, they instilled a sense of duty upon me and my sister to acknowledge where we've come from in the South, with the human rights abuses afflicted in our own backyard, and bearing the responsibility of making sure that we learn from the atrocities of slavery and human bondage, lynching, Jim Crow, mass incarceration, could go on and on. I just finished reading Isabel Wilkerson's book, Caste. One other person has read it, I see. I recommend it. She compares the caste system in India to the Holocaust of Nazi Germany, to the experience of Black Americans in the United States. And so she likens our country to a house that was built by our ancestors. So though we did not create the foundation, we did not build the house, it is our responsibility to repair and restore and maintain it, which I find that a very helpful analogy or metaphor. to remind us of where we are. I also look for guidance from Ida B. Wells, a journalist who in Memphis in the late 1800s risked her life to teach the world that the right way to right wrongs is to shine a light of truth on them. That is exactly what white people or the dominant caste must do. And then similarly in Nazi Germany, going full circle from Isabel Wilkerson's book, Lutheran minister Dietrich Bonhoeffer, he was executed while standing up against the atrocities perpetrated towards Jews and others. And he famously wrote, "Silence in the face of evil is evil itself. God will not hold us guiltless. Not to speak is to speak. Not to act is to act." So these are some of the teachings that move me and help me to understand my own identity and my role in society. When we look at infant mortality in certain zip codes here in Shelby County, we can't help but feel called to act, to speak. When we see tens of thousands of uninsured and underinsured in Memphis, we feel called to speak, to act. We've talked a good bit about burnout in this course. And so I wanted to touch on that finally, on that as well. Because certainly narrative medicine and compassion and empathy brings moral injury. And this is the term moral injury that we use to describe the weight of not being able to help as much as we want, or as much as we'd like, or as much as needed, or as much as is expected. There's so much need and we can't do it all. That creates this burden or this weight of a moral injury. Especially when we talk about not having enough time to see patients, when we're feeling rushed, we're always entering the room apologizing for keeping them waiting. Our healthcare system demands that we see a certain number of patients each day, and in primary care, we're managing all their conditions, including the human condition, as opposed to specialized care where you're dealing with one body system. This is just wildly unreasonable to expect to do in 15 minutes, right? No one's going to be able to do that. It takes 15 minutes just to room the patient alone, to get the UA, the vital signs, the A1C. Now we're giving flu shots, rapid COVID tests. And then when I think about the moral injury that comes from working in refugee settings, a situation that can easily feel overwhelmingly destitute and filled with despair, I'm reminded of the hope and resilience of those communities. So I'm reminded of the community health workers like this woman here, Rohingya woman, who travels tirelessly to educate all of her neighbors about hygiene and clean drinking water using pictures because most of the community is not literate in any language. So we all have a community in one way or the other, and no one can take that away from us no matter where we are. So keeping all this in mind, I would choose to serve the underserved again and again, because that's where I'm called to be. And I imagine you all intend to do so or want to do so, otherwise you wouldn't be in this course. And I just hope that you're able to do so. A few more quick pictures to share. Those are all my words. This is from the refugee camp as well. So imagine just a sea of different tents, essentially. Some of them are made from plastic, some of them are made from straw. Different sources of water in the refugee camps, mostly women and children gathering the water. This is a woman who brought in I think it was her grandchild, but a less than 2-week-old baby who had a rash. This was during a measles outbreak. Super concerned. Ended up not being the measles, but scary nonetheless. These are some of the medics and the doctor on the right and medic on the left who are treating a mom with her 2 little children looking on. And this is me with some of the local staff, doctor and medical assistants there in Bangladesh. Okay. Those are my questions. Those are my pictures. So yes, Dr. Nelson.
If you're gonna take questions.
We can take questions. Sure.
One comment that strikes me that talked about going to Worcester and figuring out was it Burmese refugees that you found and get them together. So it may be the word invisible, that there's people that are trying to be invisible. You don't always see, especially like you said, as a white woman, I don't necessarily see the people who are from different communities. So I love the way you were able to make a central point or a contact organization, something to let the visible people find each other. Find community. The other thing, I hear a lot of humility in what you say, which I think is the touch point, right? For doing this work is to remain humble and just recognize that we have not got it all figured out, right? No matter what your degree or your education, if only somebody else like that could help you. And I remember when we interviewed you for this job, I remember you said, you referenced your work and the record came said, no, when a family comes in and mom and grandma and they got all the kids and they need just everything. I just love that. And I thought, we're gonna rent the church now. Wasn't really a question, just a comment, but.
That's the beauty of family practice, right? You get to see the whole family. Any other questions before we do group, like some discussion?
Talked about how your parents, you talked about how your parents have raised you with certain values, and you were trying to do the same for your own children. What is your hope for like your child in the world that they're going to be in, as well as for like us, because we're going to be future health professionals. So if you were to look in the future, what would you envision, or what would you charge us with? I know that's a good question.
Yeah, it's a big one. It's so hard to know what's going to be around when Moxie is older. Yeah, she's just 3, but yeah, the world's her oyster, right? That's what you always say about little ones. Yeah, you know, I think all we can do is model, right? As parents, I mean, we model what we like to see, what we think is the right way to treat other human beings, and how we want to make life choices that aren't necessarily only about the pocketbook if we're able to, right? Not everybody has that luxury. You know, I got some loan forgiveness along the way, and you know, I still have a lot of debt, but it's a monthly payment, you know, it's something you have to, some people are willing to take it on, or can take it on, I should say, you know, right? Not everybody has that option. So yeah, I think just exposing her to different experiences, to different cultures, to different communities, letting her kind of just self-discovery, right? And without any judgment. I think that's like our goal. And then let her decide. That's kind of what my parents did. They let us decide. I mean, you can figure out what you want to do. You don't have to, money is not your goal right now. Just figure out what you want to do, what you're passionate about, and do it. And I guess the same would be for you all as well. I mean, you're already in schools, you've got your direction, you've got your passions. But just remember what fulfills you. Fulfillment is really, I think the word. Humility is good too, yes, but fulfillment, what fulfills you, because it's got to be sustainable. Right? There's too much burnout, too much moral injury in the work we do. Whether you're serving the underserved or not, there's still going to be moral injury in the health profession, any health profession.
Meredith, if fulfillment is one side of the coin, maybe the other side you could say might be like burnout or cynicism. We have done entire like sessions in serving the underserved before on like burnout and cynicism. Do you have any experience with that? Have you ever hit that in your work? Have you ever thought like, why am I on this path? How long can I do this? At what point do I need to do something different, easier? What was that like, and how do you deal with it?
Often, that happens often. Yeah, it's overwhelming. It gets overwhelming for sure, especially after long days of, you know, a certain collection of patients. I should say, if all of your patients show up in a day, there's no shows, and they're all chronic conditions, the different languages, different cultures, that's just going to be a tough day, no matter how you slice it, and no matter how much you're, you know, sitting down and focusing on, you know, this is what they're telling me. I'm in their shoes right now. You're also thinking, oh, I've got 17 other things going on right now. I have to do all these other things. So yeah, at the end of those days, yeah, those are the days where you're like, do I really have to do this? Is this really the best way for me to feel fulfilled? It balances out though. It all balances out. I mean, like with everything, there's gonna be tough days, there's gonna be good days, there's gonna be the days like the woman hugging me after she sees me, for the first time. So there's give and take, right? It all balances out in the end, I think. But yes, there are often times where I'm like, is this really what I need to be doing? But I'm always reminded, yes. Always, yeah. Other questions? Two over here. Yeah, go ahead.
Looking back, did that change anything?
That's a really hard question too, because at the time, there are certainly times where I can say it would have been different if I had taken this path. For example, I was planning to go to Baltimore for nursing school, to Johns Hopkins. That's where after I had gotten in there, I was all headed to go there. And then I got derailed to go to, derailed's probably too negative of a term, but I got redirected to UMass at Worcester because of a relationship that didn't last. But look what it brought me. It brought me finding the refugee community there that I fell in love with and became a part of. And so there's good and bads about all decisions. Good or bad, hard to say. I can't think of anything in particular. Maybe in college, I would have taken more classes outside of the liberal arts. I was very focused on history and Italian, very Western centered. So I think I probably would have explored a little bit more global things in college in hindsight.
Yeah. Since you like the experiences from long-term global health experiences, and maybe not everyone is like ready to jump into a 6-month commitment overseas or years, what are recommendations you have for people who might be doing shorter, like tips or mindsets that would be beneficial to some intent?
Yeah, I think if you do want to go overseas, and you don't have, years to spend, which most people don't, continuity, I would recommend if it's possible, if you're able to go to the same place over and over again, like Dr. Nelson goes to the same place in Haiti over and over again, that way you're at least developing relationships. And then focusing on what's sustainable. So there is certainly a need for what I call parachute medicine, which is like Doctors Without Borders, for example, amazing, wonderful organization, coming in disasters and emergencies, setting up shop, life-saving services, but it's not sustainable. It's not sustainable for the community, right? So if you're thinking about long-term, you want to go somewhere, or you're in terms of making an impact, long-term impact, you would want to go somewhere where you're able to try to establish some sustainable systems, whether you're coming and training people while you're there so they can continue to work while you're away. Or, just having that in the back of your mind as opposed to coming in and providing treatment and then leaving with nothing to follow it. So maybe that would be one way to think about it.
I think it's helpful. Everybody would want you to come to know it. Get any sort of certification for a competition. Look at how long have they been there and do they have community partners, right? Because this narrative saying is one thing to just go in as the Americans and set up a tent for 2 weeks on a mountainside and, whatever. But when you leave, so it's not really helping, maybe, it helps people that week, but what about that community? So look for an organization that works with the local dentist or local community health workers or local, if you're going to be with a team that you're going to do surgery, we'll take care of those people after the week. So really critically look at the organizations that are inviting you or offering you something for this ceremony. So who's there before we get there? Who's going to be there after? How's that supporting the community, not just satisfying our own needs and the heroes?
Other questions? Okay, so I guess just in your tables, like we did before, there's a couple of questions I have lined up for you to discuss as a group. So think of a time when you were out of your comfort zone. Maybe you were in a different place. Maybe you were just surrounded by different people that you didn't know, or people that were different from you. And how did it make you feel? And what did you learn from that experience? say maybe 5 minutes discussion, and then we'll come back together and share.
Great. Thank you. How many of these do you have?
3 total. So this is just the first one, yeah.
Okay. Well, the only other things really are
The dental, yeah.
the dental clinic, which is great. Monica also has, I think, a couple of whatever you two volunteer things. I think she's got to leave by quarter after or something. So I think we got time to let her do that. And then we can walk them over to the dental clinic. Come back and do evaluations and certificates.
Okay, so no break. It's probably okay, right?
Probably not. I mean,
Because if they do,
yeah, I mean, the dental clinic walkover is,
that can be
that's
the,
kind of a break.
well,
That's gotta stretch your legs, yeah.
that can be the way that they leave after that, leave, right?
Well, we could, if we're gonna do that, which maybe we should, because that would be kind of a good, because then they could go out from there. We just need to do, obviously, then we got these certificates, but we need to do the course evals. I've got this on paper. Yeah,
Do you want me to just only do one question?
no, do your questions.
Okay.
Do your
Sure,
questions.
cut it off at any point. No skin off my back.
No, no, you're good. You're good.
Okay.
Because I figured if we're just doing small group stuff, it's probably a good idea. Yep.